Hi everyone. Today I shall discuss with a very important bone of the leg, which is the medial strongest bone of the leg, that is known as the tibia. You see, this is the two bone of the leg. One bone, the medial bone, is the strongest, and the lateral one, it is a pointed stick like, and this is known as the fibula. This medial bone is for weight transmission toward the ground, and this lateral bone is used as a muscular attachment. Now the tibia, you will see that it has got an upper end like the other long bone. It has got a lower end here, the intervening portion which is known as the shaft. You will see the upper end, there are two condyles. The medial condyle is larger than the lateral condyle, because the medial condyle articulate with the medial condyle of the femur. So this is larger. Next you will see that between the two articular surfaces there is an elevation. This elevated mass is known as the intercondylar eminence, and this separates the knee joint structures, you will see, from this articular area. Next, this is the upper end. The upper end has got the two condyle meet in the anterior aspect and form a rough elevation, and that rough elevation is known as tibial tuberosity. So you will see in the living subject, this is the condyles of the tibia which I can feel and show, and in this part, this is the patella. You will see I can move the patella, and lower to the patella you will see there is the rough elevation, and this rough elevation is the tibial tuberosity. So this is the patellar prominence, this is the prominence of the tibial tuberosity. The person which is obese, they can feel, there is not visualization of this tibial tuberosity. So you will see this prominence thing is important for clinical examination and in the clinical practice. So you will see this is the upper end of the tibia. Now you will see, I will discuss it later on, I will show you that this is the lower end of the tibia. The lower end of the tibia, that is not so expanded like the upper end, but here you will get the medial part of the tibia, it is projected downwards, and this forms the medial malleolus. This is the medial malleolus. This is very important because you see the saphenous vein, you can look, it is more prominent here. So that saphenous vein, the great saphenous vein or long saphenous vein, it goes in front of this medial malleolus. So during the collapsing stage, when there is no persistence of the median cubital vein, we can cut here to expose the great saphenous vein. It is very easy to cut here and put the saline and the medicine through this saphenous vein, and this is known as the venesection. So you can see this is the medial malleolus of the lower end. Next you will see that I will show you another thing in the subject, that is the prominent anterior border of the shaft of the tibia, which is sinuous. I can palpate the prominent anterior border of the tibia, all of you can palpate. And on the medial side you can also feel this bone, that is the medial surface of the tibia. This is also you can palpate. So this is subcutaneous throughout its extent. So you will see in the living there is the bony prominences, and you can, all of you can feel in your body, in your family, or in the hostel, because this is the thing which actually required for the clinical anatomy or the clinical practice. Now you know how intelligent the previous means the gurus, they used to beat in this region by the scale so that the student get pain and they will do the lesson for fear of the gurus. So next thing I will discuss that in the upper end there is the attachment of capsular ligament of the knee joint, because you know this is the knee joint. It is formed by the lower end of the femur and the upper end of the tibia. So in front it is covered by the capsule. So you cannot visualize when you expose the muscle. Unless you cut the capsule, then the interior of the joint is visualized. So you will see here how the capsule is attached in this bone, that is the tibia. You will see the capsular ligament starts at the either side of the tibial tuberosity. There is a ridge. Then it ascends upwards. It goes along the margin of the articulation of the tibia. Then it goes into the posterior part of the intercondylar area. Again there is a gap. Why there is the gap? For the passing of the tendon of the popliteus muscle. So you will see here again it comes in front and it is present at the either side of the tibia. So this is the attachment of the capsular ligament. You see it starts from the tibial tuberosity on either side, then at the margin, and in the posterior part you will see posterolateral aspect there is a gap for the passage of the popliteus muscle, and there is also a groove you will see that is known as the groove for the semimembranosus and muscle, and this groove lies below this capsular attachment. So this is the capsular attachment, and this is often asked in the examination. Next thing you will see that what are the features we will see in the upper end. You will see in the upper end on the lateral side in front below the capsular ligament there is a oval facet, and this oval facet, actually this facet gives attachment to a strong band which is known as the iliotibial tract. This has got very importance in maintenance the stability of the knee joint. Next, the surfaces you will see and borders. The sharp anterior border starts from the tibial tuberosity. It has got a sinuous course, and in lower 1/3 it fades away, and it comes into the relation of the medial malleolus anterior border. So this is the shin, and medial to that there is a surface between the shin and the medial border which extend from the posterior part of the medial malleolus, ascend upwards, and ultimately it blends with the upper end of the condyle of the tibia, medial condyle of the tibia. So this is the medial border. In between the anterior border and the medial border, this surface is subcutaneous, which I am showing you in the subject. Next is that, but in the upper part, few muscles are inserted. What is the insertion of the muscle? The muscle which come from above, from the hip bone, the long slender muscle which is known as the sartorius, hockey stick like insertion of the sartorius muscle. Then there is attachment of a slender muscle, that is the medial most muscles of the thigh, that is known as the gracilis. And next, from behind, the hamstring group of muscle come and attached here, that is known as the semitendinosus. So these are the attachment of the muscle, that is the tendinous attachment, which we cannot feel. We actually say that this whole surface is subcutaneous. Now come to the lateral surface, which lies between the shin or the anterior border, and there is a border which comes from a impression in the lower part of the tibia, that is a triangular impression, from where a line goes upwards and ultimately it blends with the lateral condyle. So this border is known as the interosseous border or the lateral border of the tibia. So in between the two borders, you will see the upper part of the tibia is hollowed out, and you will see in this hollowed out portion there is attachment of a strong muscle. And what is the name of the muscle? And that is the name of the muscle is tibialis anterior. So I will show you the tibialis anterior muscle, and this is attached in this anterolateral surface, and you can feel in your body from this shin on the lateral aspect there is an elevated mass of muscle, and that is known as the tibialis anterior, which actually produce inversion of the foot. That means when the lateral border of the foot is raised, that is known as the inversion. So this is about the lateral surface. Next you come to the posterior surface of the tibia, lies between the medial border and the lateral border. And in this posterior surface you will see there is a oblique line. This oblique line is known as the soleal line, and this fades into the medial border. So you will see this soleal line. What important muscle is attached here? The important muscle is attached here is known as the soleus. That is a very big muscle, but I show its linear origin, and it also arises from the middle, this portion, though I have marked it in the blue, this portion you will see. So this is how long there is the attachment of the soleus muscles. Next I shall show you the attachment of the soleus in the soleal line. By taking these two bones together, they form a arch which is known as the soleal arch. Then it is attached in the posterior border of the fibula. So this is the such a long muscle you will see, and it forms your cuff with the gastrocnemius muscle. So you will see the bulk of the cuff in the posterior part, and their tendon which you can feel, that is by the soleus and the gastrocnemius muscle. So in this above the soleal line a muscle is inserted. What is the name of the muscle? That muscle name is popliteus. That is intracapsular origin from the femur, and it is attached on the posterior surface in this fashion. This is the attachment of the popliteus muscle. Next thing you will see the lower end of the tibia is very narrow, and this part is prone to fracture. Because of its narrowness and because of there is transmission of the branches of the nutrient artery, if this fracture occurs in the older age group, there is chance of less, that is the non-union or partial union occurs in this part of the bone. Now come to the lower end of this tibia. Now in front of the lower end of the tibia you will see number of tender passes. I does not mention the name now, but you will see in the lower end there are articular area. What are the articular area you will see here? You will see the medial articular area which is saddle shaped, and here there is the lateral articular area. Now the medial articular area articulate with the bone. This bone is known as the talus. So medial comma shaped articular surface of the talus. So this is the attachment, and here it will articulate with the lateral full form conical area, and it forms the tibio-talar joint. So that forms the part of the ankle joint. So you will see this is in short about the tibia. And what is the anatomical position of the tibia? You first you will place the upper end by seeing the transverse diameter is more, and there are two condyles, there are intercondyle or eminences. Lower end will be identified by the that is the malleolus in the lower end, and the anterior border is identified that by the shin or anterior border. So you hold the bone in such a way that the anterior border should be placed anteriorly, upper end should be placed above, and lower end is placed below, and you will see the medial malleolus, you will see it will actually determine the site of the bone. You see this is the medial malleolus, this is the on the medial side. So this is the medial sided tibia. Thank you everyone.